as we approach December 1st, which is a day of global significance, let's delve into what's the basics of AIDS and HIV. Let us shed our lights on what is actually happening, what's the prevalence. We have here Dr. Nino Badridze, as I spelled it right.
Yes, absolutely.
Okay. We have the pleasure to meeting you as well as shedding some lights on HIV and topics related to that. Let's first understand the basics of HIV and how it differs from AIDS.
So what could I tell you about the HIV and the AIDS? So HIV is just the human immunodeficiency virus, and AIDS is the acquired immunodeficiency syndrome. So they're both of them are just the first of the letters of the words. So when the person is exposed to the virus of the human immunodeficiency virus, they are getting infection till the end of their life. They are just HIV positive. After they are exposed to some of the virus, the clinical signs and symptoms are not starting immediately. It needs several times, and whether the person will develop the immunodeficiency, CD4 cell count below 14%, they will develop the signs and symptoms of the disease, and we are calling this AIDS. So to say by in other words, the AIDS is the terminal stage of the HIV.
So now that we have a clear picture on what is AIDS, can you tell me what will be the prevalence and global scenario of AIDS? Is there anything that is currently there for the prevention, and is there any advancements that we have seen in this area?
So this is quite interesting question. First of all, I would like to say I just sharing here the global HIV statistics of the UNA. According to the UNA, at the end of the 2022, there were just 39 million people who are already living right now. Among them, about 13 million are on the treatment. So the treatment is crucial for HIV. Because nowadays are available antiviral drugs which helping the people to stay absolutely healthy. So this is the one moment which is important. So the early detection of HIV is really matters. So as we just detect the patient at an early stage, and we will start the treatment in an early stage, which is we are having the better health. So in terms if there are just any the news about the treatments, there's the ongoing researches we are hoping that one day there will be the new drugs available and HIV become the curable infection. Nowadays, HIV is the treatable infection. It means are not cured, but they're just under the treatment. They're just feeling the effect of it.
Let's move on to the prevention, which is a very key aspect of HIV. And can you tell what is the strategies that is most proven successful and what we can incorporate in our day-to-day lives?
The prevention of even infectious diseases, and especially when HIV prevention is based on the first of all the people they have to understand that the risk of the HIV transmission. And then the second global approach is to find out every HIV positive and start treatment. Because if the person is on the treatment of the HIV, this is just the proof the transmission rate of HIV is dropped down by 96%. So if the people will be treated, they will not transmit this infection, and the number of the new cases will decrease. And there's the second approach, which is we are calling the pre-exposure and the post-exposure prophylaxis of HIV. So the pre-exposure prophylaxis is the design for just the special group of the people. So when we know that in the future there will be just they might be exposed, they're just starting the pre-exposure prophylaxis. Post-exposure, if somebody was exposed to HIV, which is the do prevention, the starting the treatment, which is so in terms of the prevention, so what is another aspect which is very, very important, this is the education. As we just the people are more educated, they're just the more protected around HIV.
During the COVID-19 pandemic, there were like heightened awareness about public health. So how can we leverage this momentum to strengthen the information about AIDS and HIV?
This is like really just a bit difficult to answer because like the COVID-19 is an absolutely different thing, and the HIV is an absolutely different things, and it depends on the countries, like it is a country by country.
In regions where there's high prevalence of HIV and AIDS, there is a stigma around the patients who have HIV. So how can, as a healthcare system, we can navigate this problem in the cultural diversity as well as providing like effective care for these patients?
The stigma is like really very a big issue. So also because of the stigma and because of the discrimination, they are not in the government or medical settings. So here is like just like the peer education is like the way to work. So and in the same time, like I would like just like to address like everybody who is like listening to have a page and this is not to share. So this is like just like the one of the disease which like the person can have like just like any other infectious diseases they can have like a flu or just like COVID-19 or just like hepatitis C. So when you will be like if you are just like to feel that you might be HIV positive, it is like just like the better to go to the doctor and test yourself because like you will help yourself and you will help with your other just like the people like your friends and the colleagues that like the you will be on a treatment and you will never just like transmit this.
The patients who are living with HIV or AIDS, they can have this challenge emotionally as well as physically, and what can we support or there be a supporting system for them that will be beneficial?
So for example, in Georgia we are having the HIV AIDS patient support foundation. Most of the people who are just like working there as a consultant there with HIV positives. And they're just like we're within a close collaboration, and they are just like they're helping us a lot. So when we're having with the new HIV positive, we're asking just like the person if he wants that are just like the people who are like you, so who are just like they're living with the diagnosis of almost like with 20 years. So you can just go and talk to them.
So as we wrap up, let's look towards the future. And despite the medical progresses, there is still a problem with accessing the treatment for HIV patients. So what steps can we take to ensure like if there is equitable access to healthcare globally?
So this is like just like a quite interesting question, guys. Like there is like a global fund like a program which is like working and which is like they're trying to just like have access to all the countries have access to the HIV treatment. Because if there is no like the treatment, so like there will not be like just like a decline of the HIV. So still like the people who are not like having access, somehow the government should be allowed pay attention to this because this is the really very crucial thing. We have a donor organizations or just like itself like the government and even with the HIV like the positives, they have to look they fight for their rights.
Managing HIV is unique as its own, right? So what is the difference between managing HIV and AIDS and what is it different from other infectious diseases?
The HIV is like the chronic infection. The chronic like infections what they need like the everyday management. So this is like just like the only the difference. So that they have to like they take care of themselves. Now every just like the 3 to 4 times like the per year like they have to like go to just like they visit their doctor just like to find out just like everything is like okay.
Finally, is there any promising innovations like ongoing research in the field of HIV or like AIDS that we should be optimistic about in the future?
I'm really very optimistic person that like I believe that there will be the one day so whenever HIV will like the cure for infection. Hope that one day like they just like when we will like, wake up in the morning like they just like we will just like read in our just like the newsletter so like there is like, the new drug available which can cure HIV.
So as we draw our curtains on this enlightening discussion, it's evident that the fight against HIV is not just medical intervention, but it's also a fight with a symphony of education as well as compassion as well as collective actions. And we've navigated through the misconceptions, we explored the prevention strategies and delved into the challenges that is faced by each of the HIV patients. So in the echoes of our conversations, let's carry each of our torch into our own lives and shed information to others as well, and shatter the stigma which is around the patients with HIV and support each other. And the journey against HIV or AIDS is far from what is happening right now, and but with each informed step, I think we are a closer step towards achieving the goal of informing each other. We have a heartfelt thank you to Dr. Nino Badridze for guiding us through the intricate terrain, and to our audience who is engaging in our catalyst for change, and continue the conversation, share the knowledge, and let's ensure that every day is a step towards a world free from AIDS. And this is not just the end of this show, it's a continuation of a shared commitment. Until next time, let's walk together towards a healthier, more compassionate future. Thank you for being a part of this journey.